Ask the docs, ask the docs, ask the docs, and we'll answer.
Hello out there. Welcome to our next installment of Ask the Docs. We'll be answering some of your questions today. Our first question is, are all artificial tears the same? That's a great question. Certainly a really common one. It can be overwhelming when you go to the drugstore or Walmart or Target and you're looking at the artificial tear shelves and there's a million out there. And so then, a lot of people start just looking at prices at that point and just picking the cheapest thing, or maybe you pick the best looking box or whatever. So companies are really good at getting you to pick their product, but not all of them are the same. There are specific ingredients in some artificial tears that may be better for some patients and not as good for others. If you wear contacts, there's some artificial tears that you can't use on top of contacts, so we'd be able to give you all of that information. One other tip is, in general, stay away from artificial tears that advertise like red eye relief. Most of those have in them an ingredient that causes the blood vessels on the white part of your eye to shrink and get smaller. Now, it makes your eyes look nice and white, and so that's why people typically will go for those, but it's not really fixing the problem. It's just shrinking those blood vessels temporarily, and it makes your eyes look nice and white. However, over time, that drug wears off, and your blood vessels actually rebound and get bigger, which means your eyes look red. And what does that cause you to do? You go to the store, you get more of that same drop, and you keep dumping in these red eye relief drops. So it's kind of this cycle. Your body almost gets addicted to it. In general, stay away from those, and then as far as all the other ones, come in and we can make a very specific recommendation. Hopefully that helps you.
My question is, what is astigmatism and how is it corrected? So astigmatism means that the curvature of the eye isn't perfect. So if you think of the eye as a round surface here, when you have astigmatism, the eye isn't perfectly round, or the amount of prescription going this way is different than the amount of prescription going this way. Sometimes it's described as your eye is football shaped. That's all it is. So it's not a disease, it's not anything that's bad or anything, but it does need the right thing in order to get it corrected. So you can correct it with glasses, contacts, you can have LASIK to correct certain amounts of astigmatism. And all we got to do in the glasses is make it sure that this lens is fixing this part of this prescription and this lens is fixing this part of the prescription. Same thing in contacts. Contacts can be a little bit more complicated, but totally something that we can do easily. Some amounts of astigmatism are very much more than others. So, sometimes contacts are not an option. LASIK may not be an option. Most of the time, glasses are something that can correct astigmatism. But yeah, astigmatism is a big fancy word. All it just means is the curvature is not perfect. So, but it's something we can fix with glasses. If you're not correcting the astigmatism, it can put a strain on the eyes because you're not focused in the right amount. You got this image going this way and then you're kind of taking the average, so things might be a little blurry. Yeah, there's some squinting involved with that. So I definitely want to correct it if you have it. So come on in, we can check it and figure out the best way to correct your astigmatism if you have it. All right, well, thanks for tuning in for another episode of Ask the Docs. We'll be back next time, and as always, we thank you for watching.
Thanks.
Take care.